Hi, I'm with Pam today, a 52-year-old female experiencing an acute pulmonary exacerbation of cystic fibrosis. She was diagnosed with cystic fibrosis when she was 16 years old because her brother had a pancreatitis and ended up getting diagnosed, and so went down the family line and she ended up getting tested. She is one of five. I don't know how I didn't know that. 5 and 4 have cystic fibrosis. Some medical history includes pancreatitis 30 years ago. She was admitted for 2 weeks. Also, she had polyps removed from her nose twice, once 5 years ago and once 20 years ago. She also was hospitalized for, was it 10 years ago you said, for a lung clean out. Would you mind elaborating on that?
Well, I had my routine that I was supposed to do with my inhalers, 2 nebulizers that I was supposed to do with my Pulmozyme and tobramycin, and I had my vest that I was supposed to put on because it shakes your lungs, and I just wasn't doing it. Because I wasn't doing my routine as I was supposed to, I got to the point that I really got bad and I got infected. My lungs got infected, so I had to go to the hospital so that they could clear my lungs via the IV, through IV, put the medication in, the antibiotics through the IV.
So what exactly did they do? The IV, the medication was to thin out the mucus, and then did they do anything else for clean out?
So first they did the IV through the antibiotic through the IV so they can go through my system faster. And then they also did my Pro Air and my Symbicort twice a day. I had to do the Pulmozyme through the nebulizer and the tobramycin, and then I had to use an acapella or a vest to do chest PTs to clear the mucus from my lungs.
So that sounds good, because we are going to be working on some of that today. Let me just present some of the medical history so that we can give a background to this, all right? Or some of the meds that you're taking so we can give a background to this. So the patient is currently taking Symdeco twice a day with fatty foods, as well as Symbicort twice a day, and Pro Air as needed. She's also doing Pulmozyme through a nebulizer once a day. Patient was referred to PT for airway clearance, to assist with impaired mobility and to increase endurance. So in today's treatment, we're going to be performing thoracic mobility exercises as well as chest PT, and we'll wrap up with some pursed lip breathing. Okay. So patient's prior level of function was walking 45 minutes to an hour consecutively a day, and independent with all IADLs and BADLs. She's also non-smoking. Right now, she is having shortness of breath, issue walking up and down stairs. She's unable to walk more than 10 to 15 minutes consecutively until experiencing dyspnea or increased mucus secretions. She needs breaks during grooming and BADLs. So my patient's goal here, and you can adjust if you'd like to, but I wrote down what we were talking about, is to be able to walk your 45 minutes to an hour again, to be able to breathe easier without constantly coughing, and to perform activities of daily living without needing breaks or getting shortness of breath, and to reduce your respiratory rate. Okay. You have cystic fibrosis, which is a genetic disease, meaning both your parents carry this gene. They have to at least both have recessive traits of it. It causes mucus, sweat, and digestive juices to become thick, and they could potentially clog passageways in your body, especially in the lungs and in the pancreas. So this mucus could lead to breathing problems, infections, and potentially issues digesting food. So as you are experiencing in your lungs right now, these secretions cause difficulty breathing. And they also block pancreatic ducts, so not just your airways, just they affect many things. So these ducts, so these ducts, they hold in these digestive enzymes, and eventually the pancreas starts to digest itself, and that's where you got the pancreatitis 30 years ago. So we're gonna do chest PT today. And as you've experienced before, it's going to be something similar to that. So I'm going to first start with a skin check. I'm just going to make sure everything looks good. Then I'm going to auscultate your lungs, so I'll listen to everything. If I hear anything in any areas, that's what I'm going to perform, where I'm going to perform the PT. So first, I'm going to start with percussion, which is I'm going to cup my hands like this and kind of like that in a galloping type of tone. It's not the most comfortable, but you tell me. It's to your comfort, okay? And I'm going to do that for 3 to 5 minutes. And then I'm going to do vibration on every exhale for 6 to 8 breaths, seeing how you're doing. And then I'm going to have you huff cough, which I'm going to have you try to breathe out as much as you can, like you're fogging up a mirror. So you're going to go, and then until secretions come out, okay? And then I'm going to check I'm going to do a skin check again and check for sounds, for lung sounds, okay? So, before we do chest PT, I just want to be clear that you have no recent fractures or broken ribs or active cancer or anything that I should be worried about, okay? And as for chest PT, this is very good for getting mucus out of your airways. And so it's going to decrease your shortness of breath eventually once you can breathe regularly, because that mucus isn't clearing up your airways. I have set the patient up with a chair. She's going to be scooting her butt forward to be slouched in the chair. Scoot butt forward, perfect. And then I gave her a pillow for comfort, and I gave her some towels for her secretions. So first, I'm going to do a skin check. Can you feel me?
Yes.
Perfect. Then we're going to listen, and everything looks good, no modeling or anything. We're going to listen to your lungs. All right. I'm going to check this. All right. You hear that crackling?
Lots of crackling.
So we are going to work. We are going to work on. So we're gonna work on pushing that mucus towards the airways by doing some chest PT. So first, I'm going to start with percussion, where I'm cupping my hands and I'm working around your scap, right above your scap a little bit as well, on that upper lobe. And right now I'm working on the left upper lobe. We'll also do the right upper lobe. And we're going to do percussion for 3 to 5 minutes. And this is also to your comfort. So if you're uncomfortable, if you want me to stop, you just tell me, okay? All right, ready? And as you can see, I'm pushing the mucus towards those airways for 3 to 5 minutes. Okay, so 3 to 5 minutes is up, and now we're going to do vibration, where on every exhale, I'm going to be vibrating over your upper lung, and that's going to push the mucus a little bit more. So I'm going to have you take some deep breaths, and for about 6 to 8 breaths, I'm going to be vibrating, okay? All right, so go ahead and take some deep breaths. Okay. So now that it's been the 6 to 8 breaths, you're going to do something called a huff cough, and I'm going to have you breathe out as much as you can, like you're fogging up a mirror, until you cough and get some secretions, okay? So you're going to, and she's got the paper towel there just in case, and until you cough. Go ahead. Okay. Yeah, so it's a. Do you understand. Just like that. Okay, perfect. That's some real coughing right there. So, perfect. Perfect. And you want to spit up those secretions. You don't want them lingering in there. Perfect. How are you feeling? Okay. Okay. So, now I'm going to listen to your lungs. Are you okay?
Yes.
I apologize for doing that to you.
It's okay.
Now I'm gonna listen to your lungs, and we'll see if we still hear crackling in this lobe, and then we can move on to the next one. Okay. So I don't hear anything. And do you feel me? Everything feels good. Everything looks good. Awesome. So that's that for that one, for that lobe. So now we're going to be doing the right upper lobes. And first we're going to start with a skin check. Do you feel me?
Yes.
Everything looks normal. And then we're going to listen to your lungs. Would you like to listen? Okay, do you hear that crackling?
Yes.
All right, so we're going to work on moving that to get out of your system. So I'm going to push it towards your trachea so it can eventually get out. Now I'm going to do percussion, where I'm patting at your back with my hands cupped, and we're going to do that for 3 to 5 minutes. Do you mind just slouching? Perfect. And are you ready?
Yes.
Okay. So it's been 3 to 5 minutes, and we're gonna do vibration next. Okay, so on your exhale, I'm gonna be vibrating for 6 to 8 breaths. Okay.
Okay.
All right. And go ahead. And for this, I'm using my the pads of my hands, not my fingers, if you understand. Now we're going to have you do a huff cough, which is when you are going to breathe out like you're fogging up a mirror so much until you cough, like. You understand? Perfect. Until you cough up these secretions, we're going to do this. Okay, so as you can see, she's coughing quite a bit, and this is great because she is able to get this mucus up, and the chest BT is actually helping with that. Okay. So we also did check her lower and middle lungs, and we checked for sounds, and there was no crackling, no wheeze. Her lower and middle lungs sounded good. We're going to move on to thoracic mobility exercises. And for this, I'm going to have you go up on the bed, and I'm going to have you do some like threading the needle exercises. So, or thread the needle, you know what I'm saying? Where one arm goes under and the other one opens up as much as you can, and then back down and open up as much as you can. And do it on both sides, okay? Okay, so to adjust this so that it's a little more beneficial, we're gonna have you swing your arm and your shoulder under, and then when you come up, swing your shoulder up to the ceiling and your arm facing the ceiling as much as you can.
Okay.
Okay, so go ahead. Perfect. And just really slow this down. Okay. Does this feel too easy, too...
It feels okay.
Say feels too easy.
This is super easy.
Okay.
It seems very easy.
Okay, so I'm going to have you, while you're doing this, I'm going to have you squeeze your core as much as you can up to the ceiling, okay? And continue with this exercise. And thread the needle underneath, and then shoulder up to the ceiling, hand up to the ceiling.
Okay.
You can go on the other side as well so that you're working both sides.
Okay.
Perfect.
Definitely harder.
Okay. All right. So engaging the core definitely is one progression. Okay, so we're doing an exercise called diaphragmatic breathing. This is to relax your chest muscles while you're breathing and to focus more so on using your diaphragm. So I'm going to have you lie down on your back. So what I'm going to have you do is place one hand on your chest and one hand on your belly. More down here. And I'm going to have you take deep breaths. And while you do, notice what is lifting up, your chest or your belly. So in these deep breaths, what are you feeling lifting up?
My chest.
Okay, so I'm going to have you focus on trying to lift up your belly.
Okay. When I breathe in?
Yep. So as you do that, breathe in, make sure you're going through your belly. Try to fill up your belly. And to help you, if you're having trouble, I'm going to use a tactile cue on your diaphragm. So I'm going to have you release this hand, put it by your side, breathe in through your belly, and on your inhale, I'm going to push on your diaphragm. So typically the patient would be very relaxed. Well, obviously my arm Pam can't keep it together. So
I'll be very relaxed.
Okay.
It's the first time they found out I was your aunt. Okay.
Yes, that's true. Exercise called pursed lip breathing, where you are going to breathe in for 2 seconds through your nose, and you're going to breathe out for 4 seconds, puckering your lips and breathing out through your mouth. So I'm going to have you relax your shoulders and your neck, and I'm going to have you breathe in through your nose for 2 seconds, and then breathe out through your mouth, puckering your lips for 4. So the goal of this exercise is to get out the carbon dioxide that you've got built up to kind of open up some more space for some oxygen. And it'll help you when you're having trouble breathing. Ooh, shortness of breath. I stuttered. Perfect. I'm going to start off with a skin check. So, do you feel me?
Yes.
Okay, very good. Wait, let's start over again. Okay.
Do you feel me?
This as well?
Sure.
Okay. So,
Hello. Oh, this is connected.
and we are going to work on pushing the look like a fucking Yeah, because these don't go in that way, they go in this way. You look like such a 10X here.
I didn't hear no crack. Do you hear that? What the fuck am I supposed to be listening to?
You were putting them like
Oh, okay. That makes sense.
this. And we are going to be working on
Polish.
Hi, I'm with Pam today, a 52-year-old female. Hi, I'm with Pam today, and I'm
a
with-
woman.
Bulbs removed from her nose twice, once 5 years ago and once 20 years ago.